Hello, my name is Bear Shea, and I am the Mental Health and School Counselor Specialist for the Maine Department of Education. I am a clinical social worker, and I've been a school-based social worker and clinician, as well as a clinical director in public schools before joining the DOE. This conversation is really about the impacts of COVID on mental health, how we can be aware and prepare those supports, and really looking into some of the behavior and impacts that we might see, as well as some practical ways that we can provide supports. And so that's what we're going to be tackling. I think an important place to start is really with the acknowledgement of what the COVID-19 crisis has meant. And for those of you who have done trainings with me before, you know that I often go to this, but this is not the new normal. Where the crisis is at and what's happening for us, all of these pieces that we're going through, we're still in the middle of this crisis, right? This hasn't ended. We're not coming out of the other side of it. These things aren't normal still. They're still part of the emergency crisis that we are finding ourselves in. So all of those things that we're doing, experiencing, feeling, and all of those extra pieces that we're taking on to provide safety for ourselves and our students, it's not normal. This isn't normal. Another way of understanding this crisis is to think about the impact that it's had, not just individually in our families, our communities, even our state, but that this is a pandemic that has affected a huge amount of people. What we know about crises is that human beings respond in very specific ways. And in the United States, we haven't had a lot of experience with long-term crises. Most of our crises have been sort of natural disasters or short-term experiences. The difficult thing about this crisis is that it is happening over such a long period of time, and it's something culturally we're not used to and don't have a lot of experience. Unfortunately, there has been a lot of experience with this in the world, and there's really a large database to be able to show us what it's like to be part of a long-term crisis. And this graph is a really good example of where we are right now and a reminder that we're not out of this emergency. So if you look at where this graph starts, it starts sort of in the beginning, the pre-disaster phase. So as we started to hear about things in January, February, when we started having COVID cases popping up, the impact on us for those emotional lows and those emotional highs, the way that our brains sort of register what's going on is we start to feel that threat and that anxiety. Then the impact happens when we really saw those numbers start to skyrocket. We started closing schools and closing businesses. We saw this sort of heroic effort of all of us coming together really in the best ways that we do as humans of like, this is all of us, we're going to fight against this. The tough part is that over a long period of time, we start to run out of that energy and we go into this huge disillusionment phase. And you can see that significant drop. This is where we are now. This is where we've been for a number of months. And it's that sort of that wet blanket, that drag of energy of just feeling like we're just slogging through this. It all comes in this disillusionment phase where sometimes there's little bursts of unity and all right, we're all going to wear masks. We're all going to reopen our businesses. We're all going to engage in these things. And then when those don't work or we don't feel like we're moving through, another drop in disillusionment. And so that's where we are. And we're in a spike right now where we're opening up our schools and how are we providing safety and all of the stress and anxiety that comes with that. That is all due to the fact that we are still in this crisis. And it's a really important thing to acknowledge and understand. We're not over here in this reconstruction phase where we're starting to build new things and we are establishing a new normal. This is just what we're doing right now as a response to an emergency situation. None of this is normal. So if this is where we are, we know the crisis is happening. We actually have specific expected impacts from a crisis that we know human beings will respond to. These are the expected ways that human beings respond under threat, under pressure, under stress. We know that we're going to see increases in fear, anxiety, worry. We're going to see changes in sleeping and eating, withdrawal from favorite activities, worsening of pre-existing conditions, increased use of negative coping. All of these are the things that we should expect when human beings are under duress. it's also the things that we know are affecting not just us and our families and our communities, but our students. And so these are the expected things. And I've said this before in other trainings, but if we're not seeing these things, that's when we should be concerned, because something else is going on. This is what we're all doing all of the time, no matter how good we are at hiding it. This is what is going on for our brains. When we start thinking about how that impact looks in our students and their behavior, we can really move into another area. When it comes to how our brains are responding to stress, it really breaks out into 4 major areas. Right? There are 4 survival methods that we use, all of us as human beings: fight, flight, and freeze and submit. And these are things that we've talked about, in classroom management and just in our popular culture. But it's really different when we start to actually look at how our brains biologically respond to threat and stress. We know that our brains respond based on our past experience of how we lived and worked through stress, our access to basic needs, and really what is going on for us right now. All of those pieces go into how our survival brain is logging this threat and stress and this experience of crisis. And for our students, we can see that as safety-seeking behavior, right? So the fight, flight, and freeze and submit, they're ways of our brains to survive. And so really, in order to survive, we're looking for safety. We are looking to get out of a situation that feels threatened and move into a situation that feels safe. And so we use these behaviors. What we should be expecting, and probably what we'll be seeing on the fight or flight side for students, is physical verbal aggression, pacing, feeling like things aren't making sense, running at the mouth, arguing, sort of feeling combative. And then we know that in the extreme senses, we can start seeing some suicidal thoughts and self-harm. And that also students that we might have expected to be in that fight or flight may be showing us these pieces. They might also be on the freeze and submit side, which again they're 2 separate ways of responding. So fight and flight is sort of one side of the coin. Freeze and submit is the other. It's non-responsive, shutting down, isolating, really agreeing. So I'm going to tell you to do this thing, and I'm going to do that one thing so that I can get through this moment. And we also know that on the extreme side of here, we'll also see self-harm and suicidal ideation. And so it's really important to be aware of these 2 separate sides of the coin of survival. And some of the behavior and responses we're going to be seeing may fall into these categories. There's lots more training that we could be doing in this area, and I can share some links for other training that we've done through fight, flight, and freeze or submit. But it's a really good place to sort of just understand how all human survival brains react, and that these are things that we might see from students and that they might surprise us depending on where they're at in their own safety-seeking behaviors. So if we're seeing these sort of dysregulated brain, these survival responses, these safety-seeking behaviors, what are the ways that we can support our students? And when we think about these responses that might be really difficult and have caused classroom difficulty in the past, and certainly now in a situation where things feel even more on edge, these might be problematic behaviors in the classroom. If we look at those behaviors as a safety-seeking behavior, then we know that the brain wants to get into a place where it feels safe. And so how do we provide safety? Structure is a really great way. I know from our, a lot of the training that we get in classroom management is around providing structure. Structure can look like a lot of things, and structure certainly is letting somebody know that they're safe and that somebody else is providing that sort of control and protection. However, the structure needs to still feel safe and be accessible, and have some genuine connection and even some flexibility in order for it to feel safe. The norms and the way that we handle things now, it's something that we do really well every single year, right? Like these are not new skills for us. We welcome students every fall after not having seen them for a few months, not knowing what has happened to them, what impacts, where their own mental health and stress is. We know that this is going to be a much more intense year, but it's going back to those same skills. How are we teaching, representing those new norms, really giving them a new tool set, introducing them in a safe, accessible way to what the new structure is. Really looking at policies and plans, introducing all of our other support systems that we normally have. Family engagement is going to be a huge role in this, checking in with our families, seeing how they're dealing with the stress and supports they could use, and really thinking about our goal is really regulating those brains. When our brains are out of that survival mode, we're going to see that a huge decrease in those behaviors, in that fight or flight and freeze or submit. And really the key piece to building safety in the classroom is going to be building those intentional relationships. And these are pieces that we'll talk in depth more later on in this conversation. So if this is where our students are at and the supports that we can try to put in place to help regulate their brains so that they're not in that safety-seeking behavior, it also really brings to mind, what are the impacts on us? How is it affecting our safety-seeking behavior? And when we start to think about that, how are we experiencing things now? What are these stressors, these pressures, the thought of the unknown? How is that impacting our survival mechanisms? That lack of the ability to plan is a really big one. We're planners, right? We want to set out all of our goals and know where we're going from next step to next step. And right now we can't plan. It's one of those situations where we feel like we're helpless, like something can change at any time. It's not just being flexible. It's really just not knowing what direction things are going to go in. And that puts a toll on our brain and on that threat level and that feeling of survival. Thinking about our health concerns, having those just racing thoughts all the time of what are we going to do? How are things going to happen? That anxiety, the not being able to sleep, or feeling completely physically exhausted. And really, still experiencing the grief and loss. That we lost out on a lot of things in the spring and through the summer, and that's a grief that we're still carrying with us that we may not have been able to resolve. So all of these pieces, all of these stressors are going to affect our own fight or flight and freeze or submit, our own survival methods. And so our brain, when it's in that survival space, we might feel on edge, short-tempered, have like tightened up muscles, notice that we're avoiding situations or certain people, maybe lashing out a little bit, noticing maybe some road rage or some of those risky behaviors might be increasing. Or on the other side, the freeze and submit side, isolating ourselves, tuning things out, really trying to remove ourselves from a lot of the intensity in the situation. And notice that on both of these sides, there in the extremes, there is the risk for suicidal thoughts and self-harm. And so it's something that we need to really pay attention to, is how is this impacting us? And what are the ways, what are the things that we can do to put in supports to make sure that we're at our best and that our brains aren't in that safety-seeking behavior? And this is a really important place to think about. I think we're really good at taking care of our students. We're really good at focusing on them and what they need. And we really need to be aware of what are the things that we need so that we can be at our best. Understanding that stress response, understanding how those survival mechanisms work in us, and really acknowledging and validating that we are in the middle of this crisis still. We carry a load as educators that is unique. We're not only aware of ourselves and our families, but we're aware of all of these students that are in our care and their families and how they're experiencing this crisis. It really does add on a whole extra level to this. For those of you who've been in my trainings before, I have a tough time with the term self-care. It's something that we kind of throw around loosely, and we laugh it off in meetings of like, yeah, I do self-care. And, when I'm stressed out, we were stressed out as educators before COVID-19. And, we struggled to come up with our own self-care then. we need to really think about what are the intentional things that we can do to take care of ourselves that we actually need, that are going to match the level of crisis, the level of stress that we are in right now. We can't use those same old go-to things. They need to be new, and they need to be intentional, because this crisis is ongoing. It is wearing us down. And so how are we replenishing that? How are we getting back into things? Thinking about this as, individual versus communal. In our culture, we tend to really focus individually on struggles. When we're stressed out, it's all about pulling ourselves up. We tend to grieve alone. This is a situation where all of us are experiencing this at the same time. Certainly our experiences are unique, but it allows us a way to connect with each other that can share this experience and help carry that load. Finding relationships for ourselves that are really important and nurturing those, and being intentional in connecting, and really requiring space for ourselves to practice some of those skills to regulate, to have our brain not be in that survival state. These are things that are really important for us to be at our best, so that we can support our students in regulating their brains and being at their best. This is part of the safety piece, is not just providing safety for our students, but making sure that we're in a safe place so that we can access the best parts of our brain to be there for them. So when we're talking about support, there is one thing that I often hate to bring up, but it's a really key thing. And I've sort of titled this the obnoxiously obvious. These are the things that we know, that we've been told time and time again. These are the core things that are so important to our own health and well-being, even when we're not stressed out, even when there isn't an active crisis. And so I feel a little disingenuous sort of sharing these, but they're so important. They're the things that we tell our students all the time, making sure that you're getting healthy meals, getting sleep, right? Going to bed on time, unplugging from social media, setting manageable priorities, keeping a routine. Like, these are the obnoxiously obvious things that we know, but that we so rarely do. I would be impressed if we could go through this list and really start checking off things that we've been doing. And so it's really an important time to take a reflection and to look at these obnoxiously obvious ways of taking care of ourselves and see if we're actually doing them. It's a really good place to start. So before we move on to some of the practical ways that we can support students in the classroom and ways that we can really look to build in that safety that we've been talking about, I think it's important to sort of acknowledge that this has been a heavy conversation, and that what we are talking about is something that's been going on for us now for many months, and that acknowledging that and being able to validate how complicated and difficult and stressful things have been is really important. I think we tend to have a culture of soldiering on as educators, and no matter what's going on for us, coming in and bringing our best and putting on our best face for our students. And that's, a strength that we have as educators. I think acknowledging that this isn't a normal time, what is happening isn't normal, nor should it be the new normal. That this really is what we are doing to fill the time during this crisis. And that this is an emergency situation. All of these things that we're doing, they're not the new normal, because as soon as we get back to when we can, we're going to stop doing them, right? We're going to go back to what we know is best. And so I think it's just an important place to sort of take a beat and acknowledge that these are unprecedented times, and what we're doing is intense. And so as we're moving forward in this work, looking to provide what's best for our students, it's really important that we go back to some of those obnoxiously obvious pieces and other ways that we can be self-aware about what our stressors are and how they're affecting us. So from here, we're going to move into how are we going to look at, knowing now everything that we do about the impacts, how we're going to look at supporting students' brains and making sure that they're at their best. And I'm going to start from sort of a big picture space and then work down to some of the individual one-on-one pieces that we can do down in the classroom. And I know some of these will be things that we've already put in place and things that we did in the spring, but I want to make sure that we're covering as much ground as possible, and that I'm providing as many of these different ideas to you so that you can make sure that we're incorporating all of these best practices as much as possible. And that this burden isn't just on us as classroom educators, as people who are right on the front lines, or for those of us that are trying to organize and provide so much guidance for the daily plans of what's happening. Each one of these are different pieces that can work to support students, and all together, they're a really powerful way that we can create safety in our schools. So let's jump into the first one. I think starting with policies is a really good place, and it's some of these overarching ideas and even just ways of thinking and awareness that are going to really drive some of the interventions and supports that we can put in place. Going back and looking at how are we doing mandated reporting? What is the guidance around how we're navigating some of the gray areas that we might be seeing in virtual realms or related to some of these safety-seeking behaviors that we're going to see from students? Looking at what are some of the preventative pieces that we can put forward, knowing that we're probably going to see some virtual behavior like we did in the spring, and then what supports do we have in place? Really looking at identifying students that are at risk and our vulnerable populations is going to be really important. Are there ways of tracking those students and making sure that we have just contact with them, knowing that relationships are so important? So even looking, sort of not whether they're accessing their academics yet, but whether we're actually being able to access them to provide some of that connection and support that might allow them to feel in a safer place to be able to take the risk of accessing the academics and education during this time. These are all different things that we can put in place that will provide some of that overarching security and will allow the things that we're doing directly in the classroom or in that direct interaction with students. It will give it that much more support for the work that we're actually doing. So the more of this that permeates all these different levels, the better that we'll feel and the more information that we'll have and the less anxiety that we'll have, which will then be able to allow us to work with our students that much better and create safe spaces for their brains. So moving out of policy, we can look at the pieces that we're actually providing directly on the ground to students in classrooms and sort of those overarching pieces of safety that we provide as the leadership that's in that classroom. And I think one of the things to talk about is, structure is safety. And we talk about how that impacts students and that we feel safe when other people are showing us that they're in charge and that they're responsible and they're in control. And I think, as I said earlier, the structure needs to feel safe. It needs to be accessible to students. It needs to feel like it's genuine and that it's coming from someone who cares about them rather than someone who's trying to manage them. And I think that leads into the second one, is that caring is safety. We know that there have been a number of tests where students perform significantly better when they know that the person giving them the test cares about them. Students report better relationship and do better academically when they also report that they feel like their teacher cares about them and who they are, and they care about their teacher. And so that really goes back to that relationship. And when we're talking about providing safety and security and structure, particularly during a time when there's a lot of risk, where we are talking about actually mitigating the spread of a virus that is life and death, it's a lot of responsibility on us. And so there is that tendency of this is really significant. There are structures here, just like we wouldn't allow a child not to wear a seatbelt in the car. We also are going to make sure that students are wearing masks and following protocols. How we go about setting that up so that it feels safe, so that it isn't a command, so that it isn't forcing a student into a place where their response goes back into that fight, flight, or freeze or submit. And that's a really tricky place to navigate. And a big part of it is going to be through that relationship. When we have a relationship with someone, we're more willing to take risks when they ask something of us, right? We're more willing to engage with something when it's challenging. And ways of creating relationships with students, particularly students that we may have had problematic relationships with in the past, is really going back to that genuine place of, even though this is sometimes difficult, even though we're all sort of experiencing this, I have a hard time wearing a mask. This whole thing feels so strange. Going back to that humanizing who we are allows us to be more accessible to our students. And it's a really important way. And obviously it's appropriate. We want to make sure that what we are relating to our students is appropriate, but that it's acknowledging that we're human beings, which I know for some of our students is always odd. They sort of see us in a shopping center and they wouldn't imagine that we would exist outside of school, right? So part of it is really lowering that barrier, which can get into a space that might feel uncomfortable for some of us that are used to a more black and white sort of system of management and control. But the advantage of this approach is that it really allows us to build a relationship that then provides some of that safety and security and allows that student to know that we care and that's why we're taking care of them. And that goes back to that validating and really acknowledging when things are difficult for students, being able to say, yes, this is really tough and we're going to do this together. And how can we figure out a way that makes this work so that we can make sure that we're all safe? It's not saying that what they're feeling isn't important. It's really validating it. It doesn't necessarily need to say that that is true and that what they're saying is what we're going to do, but it's acknowledging that what they're saying is a valid thing and that it might be really intense for them. And so how are we pairing with them in that moment and then introducing the other pieces that we can work on together to figure out how to keep things safe? I think being aware of that survival response is a really good way of sort of taking the judgment off of sometimes the behavior or the reaction that students give us. And there's a difference between a student really seeming like they're struggling and manipulating and trying to control the situation and realizing that in that moment, their brain is dysregulated and kind of on fire and trying to figure out whatever it can do to get into a safe space. And that safety seeking isn't rational because their whole brain isn't online, because they're going from that primal survival space. So a lot of what they're doing doesn't seem to make sense. All of these things, taking this bigger picture into account, it allows us to look at how are we providing that safety, that relationship, that connection. And we'll talk more about that as we move down this chain as well. So let's move back over here. So this next part is something that we've all been thinking about a lot over the summer. And as we've been practicing mask wearing, and those of us who have children are having them mask wear, and all of the issues and the barriers that are coming up just from the masks, let alone all of the other stressors we have. So I wanted to do just a brief piece on teaching through the mask and what are ways that we can be aware of the difference of the mask and things that we can put in place practically to sort of help that. I think we can acknowledge that a large part of language acquisition and even just understanding somebody comes from us being able to read somebody's lips. And that, it certainly is for all of us as English speakers, talking with other English speakers, that acquisition helps. And we know that for ESOL students, that this is a really important place, as well as hard of hearing and deaf students. And so covering up our mouth not only limits that, but it also limits the expression from a good chunk of our face. So how are we engaging? How are we using the rest of what we have to engage and talk with students? One of the things to actually take from hard of hearing and deaf culture is how are we using the rest of our body and the rest of our face to express ideas? How are we communicating with this part of our face and the rest of our bodies? And really doing rather than telling. So instead of, a lot of us are just used to talking and lecturing and even holding a, not a monotone, but sort of an easygoing tone that really only sits in the lower half of our face. It doesn't always get up into our eyes. So how are we making that part of what we're doing? How is our body telling the story? And how are we using the rest of our face to engage? And that might be something as simple as, my smile doesn't always hit the tops of my eyes, even if I'm really smiling. And so it might be doing something as simple as when I go to do a normal smile in my mask, I'll open my mouth. And what it does is it widens my eyes. All of us, when we do that, it pops our eyes. And so it allows us to seem like we're smiling. So we have to exaggerate a little bit to bridge that gap in the barrier of the mask. Another thing that I've heard some schools doing is doing picture pins. So a picture of our face that we can wear so that students can see that pin and see what we look like. It's going to take some practice for us to get used to identifying each other just by our eyes. And it's something that students will actually get much quicker than we do and be much more comfortable with it than we are. When we think about norms and how we create those, it's something that we do every year in our class is sort of reacculturate and re-norm students who are coming off of a break, who have had experiences that we're not even aware of, and so we create those norms. So what are the norms that we're putting in the classroom this year? And yes, there's a much more significant part to that. And it's also a part that we're not used to. We're used to norming students every single year the way that we do it. We have this whole new added layer of things that we have to be aware of, that we're under stress for. And how do we get to a place where we're comfortable setting up these norms, particularly when some of those are a moving target? We don't even know where some of those norms are. So those are things to take into account. How do we do it intentionally? I think a lot of us as educators do it naturally because we're just so used to doing it every year. So thinking about that, what are some of the intentional ways that we build norms within our classrooms and within our relationships? And I think this really speaks to an important one. And I think particularly working with younger students, there's a big, like, how do we hug students? How do we show affection as people who are working with kids that we care about? How do we help teach them and show them what affection looks like in appropriate ways? And a lot of what we do has things that we've already acculturated into showing affection. So whether it is a hug or certain gestures or ways that we interact, those are already built in, and students have already picked up on those. The tough part is when we're limiting physical contact and when we're limiting some of the view of our face, it's going to be difficult to navigate how we show affection and what that means for students. And so this is a really good opportunity to intentionally create some like rituals, maybe some even silly things like, hey, when I do this, it means that I care for you. So when you're looking out across the playground and you're looking for me, and you do this thing and I do this thing, it's just like a hug. It's just like me showing that's affection and that I care. And by saying this outright and by coming up with these ideas with the students and incorporating them into it, it creates a whole new layer of safety. Not only are you actually telling them that I care about you, but I'm actually coming up with a way to show that so that we can do it regularly. So when you're uncomfortable, I can reinforce that I'm here for you. It's something that we do automatically, but I think it's something that we need to do intentionally right now. So it's a good place to sort of start. And even on some of those first days, I know with older students, affection is sort of its own, how do we talk about how we care about students? How do we show them in our actions? And I think those are all places that we can reinforce that. But how do we appropriately start some of these new rituals? And I know I've talked with some educators who are doing, again, like silly hand motions or, like rabbit ears, or even just, looking sideways, like all of these silly things that they're incorporating, but again, intentionally to show like, hey, I can't give you a hug right now. So this is what I'm doing. This is how I'm telling you, and I'm not just picking something. I'm making sure that communication is there. So when I do this thing, it means that I care about you. And it will put in this whole new layer of support and care. And that collaboration process is going to be really important. Bringing students into that shows them that we care about them and that what they're saying and feeling is important. I think one other thing to consider about mask wearing, and I've been giving this a lot of thought, is, there's sort of a want to lighten up masks and the wearing and have them not be so intense, and certainly not have them feel like we're in a hospital or a surgical wing. And how are we wearing masks that allow us to show who we are and our students to show who they are, but also create a symbol for how students are going to see us and recognize us. If students are, if a student's on a playground and they become uneasy or something happens, or they're really struggling with something, in a group or at lunch, and students do this a lot. They will look up and they will find the adult and they will put eyes on them, and it will allow them to know that somebody's there who's taking care of them, and then they can relax. If students have a hard time picking us out in a crowd, that might be really difficult. And if we're changing our face masks to different things every day, that might also make it really difficult for students to notice us. So thinking about wearing a face mask that has maybe a bright, consistent color that students can always identify us with. That way, when we are far away and they can't see our full face, and maybe we haven't practiced enough to be able to recognize our eyes, they'll be able to still see us and pick us out of a crowd. as well as just like our classrooms are consistent and our spaces are consistent, when we're talking about virtual and hybrid learning, having those keys that keep us grounded and that consistency of space can really help. So whether it's your background, whether it's the face mask you're wearing, all of those things can really help the brain relax and make sure that we know who we can identify so that it makes us feel safe and comfortable. So those are all things to sort of take into consideration. I'm sure we could do hours on this, and I'm really eager to get feedback from the field as you all are experimenting with this and coming out with new ways of interacting with students. I'm going to be really looking forward to that information so that I can share it. All right, so moving into this last slide here, I've saved this for last because to me, it is the most important place for creating safety for our students. And it really acknowledges the significant impact that we have as educators and that we've always had on our students' resilience. Study after study after study for 30 years has shown that a single adult involved in a student's life and a child's life who provides consistent support and engagement in a non-judgmental way is the #1 indicator of resilience for students. Over and over and over again, we see that. And when we think back on the mentors and the educators and the people we've had in our lives, those people are the ones who have allowed us to be as resilient as we are. And so that's what we do. That is like one of the primary pieces we provide for success for our students is that relationship and that connection and that support. Being there over and over again when there are so many things that are out of our control and our students' control in their lives, we can be that person that's there for them. And that idea of connection, that consistency, all of those pieces from us, it's why when we think back on our favorite teachers, we have such warm feelings because they are some of the core resilience that made us who we are today. All of those things are even more important right now. And we know that. We know that our students are coming in with all sorts of struggles on top of the ones that they already had. And there's really this onus on us of how are we creating this now in a really intentional way? How are we bridging these gaps with students to create relationship intentionally? It's something that we tend to do automatically, engaging with students and creating that work and that support. It's one of the reasons why we love being educators. This is an extra level. Just like I'm saying that we need to put extra sort of self-care in for us, this is another place of an intentional raising up of relationship to make sure that we're making those connections and bridging those gaps with students. And it means sort of bridging some of those gaps with students that we might have had difficult relationships with and contentious relationships with. And how are we going to use some of these skills and the knowledge about safety-seeking behavior to reach out to them in a genuine way and try to create a safe relationship so that their brain can regulate, so that we can make that connection, and so that we can take on the challenges and all of the difficulties that are in this crisis right now. How do we take all of these things that we've been talking about in this conversation and put them into a way of interacting with students so that we're developing that relationship, we're strengthening it, we are becoming that major prime factor for resilience in that student's life. It's one of the unique pieces that we have as educators to do that. Other professions don't get to do what we do. They don't get to have that impact on a child's life the way that we get every single day when they're in our care. And so putting that on in an intentional way, really crossing those gaps and finding ways to view that student and the difficulty that's going on in their dysregulated brain that's on fire. How are we reaching out and creating a safer space for them and starting to repair maybe relationships that have been damaged or old baggage that they're carrying over damaged relationships? How are we becoming that new person that they feel safe with, that they can connect to, even if maybe they didn't before? How are we finding and talking and connecting with the people that they do feel safe with so that we can take advantage of those relationships that already exist to bolster these relationships we're trying to build with them? All of these pieces are really part and parcel to creating safety and really significantly supporting our students before we even think about academics and math and reading. How do we take relationship and put it in as the 4th R? If reading, writing, and arithmetic are the 3 primaries, Relationship has got to be up there. And I think right now, with where the crisis is at, it needs to be the primary support. So it's just one more piece to really consider, and to do it in a really intentional way. And I know I just spent a lot of time kind of dumping this on you. And this is something that we do inherently. It's part of our skill set. It's part of why we're good with having kids be successful, and having students come back to us after years, and engage with us and reflect on the successes that they've had. It's because of this relationship. It isn't because we taught them this one cool trick in math. It's because we were able to see who they were and care who they were, and give them that extra bit that allowed them to feel safe. So think about that with every student we have, particularly with the ones that we've had difficult relationships with. How are we bridging those gaps, and how are we putting ourselves out there so that they know that they're safe with us? All of these pieces can really lead to a place where, even when things are dysregulating outside of where we are, being in our presence, being with us, being with the community and culture that we create is safe, and it will allow their brains to regulate, no matter all of those other things that we can't control, whether it's what's going on at home or whether it's a global pandemic. We can regulate our brains when we feel safe with the people around us. And that can be our classrooms. It can be, our interactions with students. And so it's a power that we have, that is a skill we have to practice and cultivate. And it's one we can do intentionally. So with all this being said, all of this information I've tried to get to you as efficiently as possible. I just want to say, knowing where everything is at right now, and the intensity of what we're doing, as well as just the significance and the importance of all of these interactions we're having in providing safety for these children. It's something that we take on normally in our profession. It's something that we pride ourselves on. And right now, it's even more important than usual. And what's being asked of us is much larger than it has been. And here we are, stepping into it, and going forward, and joining with our students, and doing the best that we can to support them. And I just want to say, from all of us at the DOE, thank you so much for what you're doing. Thank you for the support, and that relationship that is going to provide that resilience for our students, and really our families and our communities. You're the glue that's holding a lot of this together right now. And so I just want to say thanks very much, and please feel free to reach out for any additional information or ways that I can support. Thanks.